Health insurance companies offer a variety of health insurance plans in order to give consumers choices. But what do they all mean? Understanding the different types of plans is key to finding the plan that works best for you. There are several different types of plans that will impact how you access healthcare, the networks you can use, and your out-of-pocket costs. The different types of plans are HMO, Health Maintenance Organization; EPO, Exclusive Provider Organization; PPO, Preferred Provider Organization; POS, Point of Service Plan; Catastrophic Plans; High Deductible Plans; Government-Supported Plans. What exactly are each of these plans, and how do they differ? Before we get into that, first you need to understand who the providers are and what a network is. Within the healthcare system, there are primary care physicians and specialists. A primary care physician is a medical doctor or doctor of osteopathic medicine who directly provides or coordinates a range of healthcare services for you as the patient. A specialist is a physician who focuses on a specific area of medicine to diagnose, manage, prevent, or treat certain types of symptoms and conditions. It is also important to understand what a network is. A network is a group of doctors, hospitals, laboratories, and other healthcare services that have contracted with a health insurance company to provide a service. These providers can be in multiple health insurance company networks. Now that you know what a network is, let's explore those plans I mentioned earlier. An HMO, or Health Maintenance Organization, is a plan that has a network and requires you to have a primary care physician, or PCP. The PCP is your primary contact for healthcare service, and you must get a referral to visit a specialist or have laboratory tests done. It's important to note that you can see an out-of-network provider, but you will be responsible for 100% of the cost of the visit. To take advantage of your insurance benefit, you should only see in-network providers. Because of these restrictions, the costs for an HMO plan tend to be lower. An EPO is an exclusive provider organization. Like an HMO, it also has a network from which you choose providers, but you do not need to get a referral from a primary care physician to see a specialist. As long as you stay within your network, you can see any physician you would like. Like an HMO, if you go out of network, you will be responsible for the full cost of the visit. Because of the network restrictions, costs tend to be lower with an EPO. A PPO is a preferred provider organization, and it offers you the flexibility of in-network and out-of-network providers. It is cheaper to use in-network providers, and you don't need referrals from a primary care physician. This plan tends to have higher premium costs, but may have lower co-payment and co-insurance costs as long as you stay in-network. When you use out-of-network services, you will have a greater financial responsibility, but costs will still be shared with the insurance company. A POS, or Point of Service Plan, has a network and requires you to get a referral from your primary care physician in order to see a specialist. However, you can see out-of-network providers. This plan tends to be lower in cost than a PPO, but higher than an HMO or EPO. Catastrophic plans are for people who are under age 30 or have some sort of hardship, like being low income. These plans cover preventative services and 3 additional healthcare visits per year without having to meet the deductible. Deductibles are high for these plans, but after you reach this amount, your insurance company pays for all covered services with no co-payment or co-insurance. A high deductible healthcare plan has a higher deductible than a traditional insurance plan. The monthly premium is usually lower, but you pay more healthcare costs yourself before the insurance company starts to pay its share. To offset the higher out-of-pocket costs, a high-deductible healthcare plan can be combined with a health savings account, or HSA. An HSA allows you to put aside money to pay for certain medical expenses, free from federal taxes. High-deductible plans can be offered with an EPO, PPO, POS, or HMO types of health insurance. No matter which type of plan you have, in an emergency, you can access any emergency department. They will always be considered in-network. So where do you get these health insurance plans? Most of these plan options are available on the health insurance marketplace, through your employer, directly from health insurance companies, or through a health insurance broker. A broker is a business person who represents multiple health insurance providers and works to find a plan that best meets your needs. In addition, some organizations like the Chamber of Commerce, Farm Bureau, or other professional associations offer plans if you're a member. Government-supported programs include Medicaid and the Children's Health Insurance Program, also known as CHIP. These are available to low-income individuals, and eligibility depends on income and family size. Each state has established guidelines. If you have limited income, it is worth your time to determine if you are eligible. More information can be found at Medicaid.gov. Another government-supported plan is Medicare. It is the program for citizens over the age of 65 and covers hospitalization, doctor's visits, and other essential health care services. Visit your local Social Security office or Medicare.gov for more information. Lastly, if you are or were a member of the armed forces, you may be eligible for health care services through the military health system. For more information, visit health.mil. With so many choices, how do you choose? If you are employed, you'll have to pick one of the plans that your employer offers, unless the cost for your coverage is over 9.56% of your total household income. If you are self-employed or unemployed, you'll purchase the plan either from the health insurance marketplace or directly from a health insurance provider or broker. If you are or were in the armed forces or are low income, connect with the appropriate agency and apply. For Medicaid and CHIP programs, you can apply through your state's healthcare marketplace website as well. If you're a member of a business organization, you can choose to use their plan or shop around for other options. No matter where you get your plan, you want to think about how often you use healthcare services and the types of healthcare conditions you are managing. If you have a condition that requires a lot of labs or doctor visits, it is important to estimate your healthcare costs to determine what plan will be best for you. You also want to think about the doctors you see and if they are in the network of the plan you are considering. You can find out by contacting your doctor or the health insurance provider and determining if the doctor is in the network of the health insurance company and the type of plan you are considering. As an example, just because your doctor accepts a health insurance company's PPO doesn't mean that they accept their HMO. If you travel a lot, having access to out-of-network services may be beneficial. In this case, you'll want to consider a PPO or POS plan. Understanding the plan you are choosing helps you access the care you need in the way that works best for you. Select a plan that best fits both your medical needs and your finances. I know we just reviewed a lot of info, so visit our website to learn more about choosing and using your health insurance plan.